very good morning to you. How are you doing? I hope that you're well, that you've had an amazing week. Right from Sunday, we agreed that week starts on Sunday, but our week starts on Wednesday, yeah? Where we talk about health, we talk about everything, your body, and actually on Afya Clinic, we talk about your mental health as well. So it's generally your well-being. So karibu sana, my name is Kahugo, and today we're going to be having an amazing time right here mpaka pale 10 in the AM. All right, so I hope that you've been well, that you've had an amazing week, that you've had an amazing night kwa mkia leo, and we thank the Lord for yet another day on the 13th of November 2024. Time is really running, but I hope that you are doing something. Yeah, that each and every day you are making a step forward. We said it's not about doing so many things. You see, ile goal lenye tulikuwa tumeweka pale juu, break it down and do something small each and every day. Okay? And I know that with the help of God, we'll be able to have been accomplished all our New Year's resolutions 2024. Okay? So karibuni sana, this is MBCI TV, ambapo tunabadilisha maisha by the grace of God. And my name is Kahugo. Very happy, very excited, very blessed to be here. And today, ndani ya Afya Clinic, we'll be having an amazing time. We'll be starting with the health updates because it's very important for you to know what exactly is happening in the health sector. And then after that, we'll be getting the In History segment where we talk about our topic of discussion today that I'll be introducing in a very short while. And Doc is already here with us, so we'll be getting to understand more about our bodies, more about our health. And you know, what our Facebook already meona exactly what we are talking about. And just to let you know, our numbers are very open. 0721 105 105 on WhatsApp, 23814, our SMS code, which is absolutely free of charge. But we are live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page, and on Rachel Kahugo on all social media pages. Utaweza kunipata pale. And when you send in your comments or your feedbacks right there, we'll be able to get them. But for now, tutakuwa tukianza na the health updates because it's very important for us to know what's happening in our country in terms of health, so that if there's something you need to do, you are able to do it vizuri. And on our first news today is that the Cabinet Secretary of Health or for Health reviews the HIV, TB, and malaria programs progress with the Global Fund team. So the Cabinet Secretary for Health, Dr. Deborah Barasa, on Tuesday, the 12th of November 2024, met with the Global Fund team led by Audit Manager Augustine to assess the Kenya's progress on HIV, TB, and malaria programs. The meetings highlighted key achievements such as reduced death rates and progress towards treatment targets, with 70% of Kenya's performance contracts aligned with the Global Fund priorities. Kenya's programs have been strengthened by strong governance, effective government integration, and enhanced financial reporting. The Cabinet Secretary expressed So the Cabinet Secretary expressed optimism about reaching 95 target on HIV, TB, and malaria programs, and acknowledged the Global Fund's unique support for community and private sector health initiatives. And on our second news item today is that vaccines administered to our children are safe. And this is from the Ministry of Health. They clarified this in Nairobi, Kenya, when the Ministry of Health reaffirmed the safety of vaccines administered to our children across Kenya, assuring that all vaccines go through diligent testing before being used by the public. Director General for Health, Dr. Patrick Amoth, emphasized that all vaccines, including the polio vaccine, are safe and essential for protecting children against preventable diseases. He highlighted that vaccines undergo rigid safety and value tests to ensure public safety. Dr. Amoth also noted that vaccines are developed to stimulate an immune response to helping the body fight infectious diseases. Addressing concerns from the recent polio vaccination conducted on the 2nd to 6th October 2024 across 9 counties, he confirmed that any issues that were raised were reviewed and addressed by the Vaccine Safety Advisory Committee. polio or inactivated polio vaccine. He added that during the outbreaks, polio vaccines are administered to all children under 0 to 59 months of previous vaccination status. Dr. Amoth encouraged parents to continue bringing their children for immunization, noting that vaccinations efforts have saved lives of countless children in Kenya. So this is to say that every parent, make sure that you take your kids for vaccination. It's very important. And as you've heard in our second news item today, is that all vaccines administered to all children in Kenya are safe. Okay? So that has been it on the health updates today. Now, today being a Wednesday, as I had said before, ni siku ambayo tunaongelea mambo ya afya, where we talk about everything our well-being. So if you have any topic you'd want us to tackle through our numbers, you'd be able to tell us. And you've talked about so many topics that you've said you'd want more clarification on. And today we'll be talking about pneumonia, because pneumonia is a killer disease. Yeah, and you'll be hearing that from Doc. But for now, I want us to know more about pneumonia. What exactly is pneumonia? So let's get the In History segment. As we come back, we'll be coming back with Dr. as we get to know more about that.
Pneumonia has been known since ancient times, with descriptions of lung infections appearing in early medical texts. Hippocrates, often called the father of medicine, noted the symptoms of pneumonia around 400 BC, describing severe cough, fever, and breathing difficulties. The medieval period saw little advancements, with treatments based mainly on herbal remedies and theories about bodily humors, which were still prominent until the Renaissance, when anatomical studies began offering better insights into lung infection. A breakthrough came in the 19th century with the germ theory of disease, which suggested that microorganisms rather than imbalanced tumors caused illnesses. This led to the discovery of the bacteria responsible for many pneumonia cases. Scientists Carl Friedlander and Albert Frinkel independently identified Streptococcus pneumonia and Klebsiella pneumonia, two primary bacteria associated with pneumonia. Their discoveries transformed the medical approach to pneumonia, as it became known as a bacterial infection that could potentially be treated rather than a mysterious untreatable disease. This development of antibiotics, particularly penicillin in 1928, marked a turning point, making pneumonia far less deadly in much of the world. Vaccines developed in the latter part of the 20th century, particularly the pneumococcal vaccine, provided protection for the most vulnerable populations. Today, while pneumonia still remains a leading cause of death worldwide, especially among children and the elderly, medical advances have transformed it into a largely preventable and treatable illness in many regions, highlighting the impact of scientific and medical progress.
Perfecto. So karibu sana if you're just joining us. This is the Afya Clinic. We're very excited to be here. And today we are talking about pneumonia. And I know that you've just seen the In History segment where you get to just understand what exactly pneumonia is. Yeah. And as you've heard, sadly, pneumonia is a killer disease. And we'd like to know what exactly are you supposed to do so that we reduce the cases that, oh, a kid died from pneumonia. And it's really sad that it's not only kids, even grown-ups. Yeah, and I know we'll be talking about that more. So if you have any questions, our numbers are very open, 0721 105 105, okay? That's on WhatsApp. 23814 is our SMS code, which is absolutely free of charge. We are live on Facebook, we're live on YouTube. So on Facebook, it's MBCI TV. On YouTube, it's MBCI TV official YouTube page. All right. And then on all social media pages as Rachel Kahugu, right there, you'll be able to find an amazing poster. And then on the comment section, just start with hashtag Afya Clinic, and then we'll be able to get your questions. And then Dr. will be able to answer them. But I want you to know who exactly you're having today, so that even as we get into the discussion, you'll be able to ask your questions, and even as you get answered, unajua vizuri ni nani anakujibu. Sawa sawa. So we've prepared a guest profile for you guys. So let's get into the guest profile for you to understand who exactly we are having today.
Dr. Sharon Kimani is a senior medical officer at Nakuru County Referral and Teaching Hospital, where she is dedicated to delivering high-quality healthcare while also making significant contributions to medical education and training. Dr. Kimani holds a bachelor's in medicine and bachelor's in surgery from Dalian Medical University and certifications in leadership and management from the University of Washington and basic life support BLS and advanced cardiovascular life support ACLS, and serves as a trainer of trainers for the Ministry of Health MDR TB program and the ICAP Mortality Surveillance Initiative. With a keen interest in internal health, she has built a reputation for her clinical expertise and her passion for improving patient care. Beyond her medical practice, Dr. Kimani is a philanthropist committed to making a difference in her community. She is the founder and chairperson of the Purple Heart Foundation, an organization dedicated to impacting youth in vulnerable communities. She is also the author of Dear God, a Bible study aimed to reignite one's faith. Dr. Kimani's multifaceted career reflects her unwavering commitment to both medicine and social change as she continues to inspire and lead by example in her profession and beyond.
Perfecto, and that is who we are having today. You know, psychologists say that it's usually very easy for you to relate with someone after you've known exactly who they are. And I really love having people on board, especially medics, who we're very sure that they're doing an amazing job. And for this beautiful lady, I can tell you for sure, any question that you have today, she'll be able to answer. But ni maswali za pneumonia, tafadhali. Today we are tackling pneumonia. So any question that you have, please feel free to ask and we'll be here to answer. Dr. Sharon.
Hello.
Good morning.
Good morning. How are you?
I'm fine. How are you?
Thank you so much for having me. I'm doing well.
Thank you for being here.
Yes.
Yeah, we're very glad to have you today.
Yes.
And today we are tackling pneumonia.
Yes.
Yes. And this is a disease that has taken the lives of so many people, unfortunately.
Yes.
We really heard about it during COVID.
Yes.
Yes. Actually, that's the time I actually saw an adult dying from pneumonia.
Yes.
I was like, what?
That it can happen.
Hey, this can actually
like for real?
Yes. Because I thought pneumonia was a disease that would only take the lives of
children.
kids,
Yes.
children. But now seeing that it can actually be very fatal to adults as well, we thought this is something that you need to talk about.
Yes, definitely.
So karibu sana as we talk about this topic.
Yes.
For a start, what do you say is pneumonia in layman's language?
Okay, so pneumonia, I love the way you've said layman's language, and the best layman's language I like to use for describing this particular disease is Chinese. Reason because it's very literal. So pneumonia in Chinese is fei yan, and yan in Chinese means inflammation, and fei is the chest. So it's literally an inflammation of the chest. Now, what causes this inflammation? It's infections usually. So basically, when an infection enters into your lungs, it will cause an inflammation in what we call the bronchioles or the alveoli. Now, the alveoli, they're the little houses that, or sacs of air that are there in the lungs, and the bronchioles are like the little roads or pathways that lead to those sacs of air. So any microbes, any infections that enter into that area and elicit an immune response, meaning make your body react to it, that will cause what we call inflammation. Now, that inflammation just basically means your immune system will react to it. It will cause a buildup of white blood cells. It will cause a buildup of fluids. It will cause a buildup of sometimes even red blood cells in the same sac of air, and that is what will lead to the signs and symptoms of pneumonia. Yes.
All right. Wow, that's a very simple way to understand it.
Yes.
Because every time we talk about pneumonia, inakanga kitu kubwa. It's like, we uko na pneumonia, you need help. But actually you need help. But you say that it's the inflammation of the chest.
Yes.
So by inflammation, people would think it's probably, how do I put it, inflammation? In Swahili, it's like, let me use an example. When you have air in a balloon, how it gets bigger and bigger, how it builds
inflated.
up. How it gets inflated.
Yes.
Would it be the same? Is that really
not
in
exactly
some cases what happens to the lungs?
So not exactly. So what happens to the lungs in pneumonia? It you will get that infection getting into the host cells. And that will elicit what we call the defense system of your body. So those are the white blood cells to come to that area where they found that there's an invader, right? And what they will do, they will release a particular chemical called cytokines. Okay, so this particular chemical will create a series of reactions in your body. And so the white blood cells, one thing they'll do is they'll release fluids into the lungs. It will might cause the temperature of your body to go up. It might also change the color of inside the cells. We call that red hepatization for some of the lungs. So it will cause a series of reactions inside. I think the best thing to think about is if you've hit your hand and it starts to swell. Yes, that's what we would call an inflammation. The redness, the swelling of the area. Now imagine that in your lungs. That's what happens. Yes.
And you've mentioned that you would have some liquid in the lungs. So is that what causes, sometimes it's very hard for you to breathe, or sometimes you feel some pain in the chest? Is that the reason?
Exactly. So because of that fluid in your lungs, you will definitely feel your difficulty in breathing. But also, some of the symptoms we elicit, it's because of your body trying to fight. It's trying to fight for itself. We have been made very beautifully in the sense that whenever we've got something that is not supposed to be there, your body tries its best to get out. So that's why you end up coughing, because that is your body trying to take out that microbe. That's why you end up with a lot of mucus that is going to come out either out of your nose or your mouth, because that's what we call the mucociliary mechanism that is trying to take away all of the infections from the body. So a part of it is the defense system. Another part of it is your body. No, part of it is the inflammation and the infection. The other part of it is your body trying to help you. Yes.
Okay, beautiful. So we've mentioned some of the symptoms.
Yes.
Yeah, you've talked about coughing, you've talked about the mucus, you've talked about pain.
Yes.
What are some of the other symptoms, especially the early symptoms to catch pneumonia?
Okay, so as we've already stated, cough and mucus. And the mucus is very interesting because you can have different characteristics, and that will let us know, as now medical staff, what type of pneumonia you're having. You can have like what we call a rusty sputum, so something that looks like rust that you're coughing out. You can also have sometimes blood coming out, but that will tell us of a different kind of pneumonia that we might be worried about. Yes, we can also have what we call a specific type of chest pain. That is called pleuritic chest pain. Now that's just a very big medical term for pain that is worse when you cough and pain that is worse when you breathe in and out. Yes, those are some of the symptoms. You'll also have some difficulty in breathing. Now, because of what I mentioned earlier, the cytokines, your body that is fighting so hard to try and fight this infection, you might have hotness of body. So you will be having a fever, joto. You will also have just general fatigue. So you will be tired, trying your best to move around. Yes, those are the main symptoms that you will have if you have pneumonia.
Okay. So when we started, we said that pneumonia was very rampant during the COVID season. Why would you say it happened that way?
I don't think it was rampant only during the COVID time. I think it was popularized during the COVID times. Interesting, when I was getting ready, I was reading on studies that date as far back as 2001 and 2003. And they talk about incidences and studies that were done in Kenya. And just the high incidence of pneumonia has been present, and it's been a present burden. It was just popularized over the COVID times. And it's actually globally one of the leading causes of one of the leading causes of death, infectious causes of death. Actually, the World Health UNICEF reports around 725,000 children under 5 a year, and over 190,000 newborns per year die. Not just get infected, die, secondary to pneumonia. And this is globally. In Kenya alone, we have, MOH has reported around 8,000 to 10,000 children under 5 that die per year. The adult burden is even worse. We have around 2.5 million adults affected a year globally. Yes.
That's a huge number.
A very huge number.
A very huge number.
And if you put that in comparison to our global statistics for COVID, if I was right in checking, only around 350,000 people in Kenya had COVID.
Yeah.
So 350,000 versus the millions that are getting pneumonia, it just got a very nice name over the COVID period, but it has been a global burden for decades.
Oh,
yes.
Okay. So it's really something that we need to talk about and
Yes.
sensitize people about.
Yes.
So at what point do you need to go to hospital? Now, this is where most of the Kenyans draw the line. Wanakwanga like, unless I'm dying.
Yes, we are not coming.
I'll take painkillers. Nitakuja Piriton.
Yes.
Nakunyanga nini ingine. We'll take everything.
Everything.
Unless you die. And I've seen that from even very close people. One of whom, he actually died from pneumonia.
Oh no, sorry
Yeah.
to hear that.
So, at what point do you need to go to hospital?
Okay. Now, I understand how it is growing up in Kenyan homes,
Yeah.
that you drink everything first.
Yeah.
Kabla ufike daktari, you need to do your own thing.
Exactly. No, smile, umepona.
Exactly.
Go back to work.
Just continue. Just continue on
Yeah.
your life. But I would say that is the reason why, unfortunately, in what we call, in our setup in developing countries, we have got a very poor outcome in comparison to more developed countries because of late presentation.
Okay.
So pneumonia is very treatable. Like majority of the times, it is very treatable.
Yeah.
Unless there are specific circumstances, there's no reason why somebody should not have a very good outcome after being accurately diagnosed and started to be treated on pneumonia. So when should you present yourself? Number one, I would say sooner rather than later. Soon and very soon
Yeah.
is better. But if you have the following: number one, difficulty in breathing. Don't wait until unakosa hewa kabisa, like you're not even breathing. If you're having difficulty in breathing, go and present to your nearest health facility, number one. Number two, if you have what we call a comorbidity or another illness, you know you've got an underlying illness like asthma, you've got something called COPD or bronchitis, you've got heart disease, you've got diabetes, you're somebody that deals with any other issue, you're on management for an autoimmune disease, meaning you're taking medications that will suppress your immune system, like steroids. You need to go to a health facility sooner rather than later, because you're more likely to have more severe reactions and symptoms than people who do not have those illnesses. And also people who fall into two particular categories, those who are very young and those who are very old. So if you're greater than the age of 65, you are considered, unfortunately, in our books, you are elderly.
Yeah.
If you're above the age of 65. Actually, that's even part of our criteria for admitting people for pneumonia. It's not only if you're 65, but it's one of the criteria that we look at called CURB 65. And if you're above the age of 65, you're at a higher risk of more complications. You're at a higher risk of, getting...
Why is that?
Well, for the younger people, it's because you've not been here long enough. So your defense system is not yet built to handle these things. But for the older generation, it's the opposite. You've been here for a bit too long. Not too long. You've been here for longer than the rest of us. So your immune system, it's kind of not working as it used to. So you've got a weakened immune system due to age, something called what we talked about, your mucociliary pathway. Basically, they're literal line things that push infection and mucus out. It doesn't work as well when you're older. So therefore, you retain more infections. And that is why you end up being more susceptible to more severe infections.
Okay. But for the above 65, what would you tell them? What are they supposed to do to build on their immune system? Above
65, number one, tackle any comorbidities or other illnesses that you have and make sure that they are well controlled. Unfortunately, in hospital, I typically see people who they're used to their diseases, they're used to whatever they've been dealing with. They never go for regular checkups. So they could have poorly controlled, the worst controlled diabetes, but they're just so used to it, and that is actually worsening their immune system. So if you have another illness, make sure you take care of it, number one. Number two, good exercise. Making sure that your body is fit and as fit as possible. Number three, making sure that you stay away and stay away from exposure, reducing your exposure to certain things. If you know somebody who's sick, you don't have to go and visit them. You can pray for them at home.
Until they're well.
It is fine. Pray for people at home. And you don't necessarily need to always expose yourself to everything else that is going on. Wear a mask if you have to. Stay away from cold environments, because the cold itself weakens your immune system. And also take things... Generally, yes. So, and also...
Point to notes.
Sasa unajua. Yes. And also just taking things that will help boost your immune system. We usually have lower intake of vitamins and essential minerals that will help us with our immune system and growth the older we get. So ensuring we're taking our vitamins and minerals as you grow older, that is also very important.
Okay, I see. You know, I've asked that because most of the older people, our shows, they're actually really healthy. I think it's because kitambo they used to take fats, machiko, junk, and they used to eat very healthy. So at 65, 70, they're still wako sawa kidogo, but please take more care of yourself. It is important. Now, you've mentioned the above 65, they're more prone to pneumonia, and then?
Those, the children, those under 12s, okay? Yes, so
below how many years?
12, under 12, yes, they're more susceptible to pneumonia. And in that bracket, those who are under 5 are of higher risk as well. That's because of the less developed immune system. As I said, they've not been here long enough. To build the defenses that are needed to be able to target.
I see. Now, you had mentioned about types of pneumonia. Well, you were saying you'd know the type of pneumonia from the presentation,
yes,
the symptoms, blah blah blah. So what are these types of pneumonia?
So we categorize pneumonia. Now I can either give you medical jargon, but let me give you layman's language because because there's several different categories. I think the two categories that I think we can discuss, there is pneumonia which we typically get from the community. We call that community acquired pneumonia. So even if somebody who has been admitted in hospital for less than 48 hours, you have and you've been diagnosed with pneumonia, you have what we call community acquired pneumonia. And this is the best type of pneumonia to have. None is good, but it's the best type because it's the one that is easily treatable by medications. If you've been in the hospital, there are different categories, but let me just put it under one umbrella of hospital-acquired pneumonia. So if you've been in the hospital for a long period of time, then you can also get an infection while you are there, and that is called hospital-acquired. Now, those are the two categories with regards to where you got it. Now, the causative factors, they are around 6 different causative factors. There is bacterial pneumonia, and actually, around 80% of bacterial pneumonia is found to be something we call Streptococcus pneumoniae. That's just a big medical term for a specific type of bacteria that is found to to cause pneumonia. So there is bacteria, there are viruses. Now viruses, that's what we would call the common cold. Ihoma that we get that other people can just easily get, and it will typically give us a dry cough for the common cold versus bacterial pneumonia. That's when you have the wet cough, you're coughing different types on different colors of sputum or mucus. You can also get what we call fungal pneumonia. So it's very interesting that funguses can infect the lungs. You're just like a fungus, clearly. That is specifically though for people who are immunocompromised. So people who might have different diseases like cancer, those who've got HIV, those who are taking medications that will reduce their immunity. For instance, those who have organ transplants like kidney transplants, those who have autoimmune diseases, as I mentioned earlier, they are on long-term steroids. So that's how they can get fungal pneumonia. There are also there's also something called mycobacterium. That we can get. I know the most popular mycobacterium that we are aware of is TB. That is also classified as a part of pneumonia. And finally, Additionally, we also have...
Hold on, let me take you back kidogo. TB is also classified as pneumonia.
No. So this is where it gets confusing.
No,
this is where it gets confusing. So you can have something called acute tuberculosis pneumonia. That's ATP. So that's basically an acute presentation of pulmonary or lung tuberculosis. That's when it's classified as a pneumonia. But TB in itself can affect any organ in the body except the hair and the nails. So unless it has this specific presentation that we call ATP, it is not pneumonia. But when it presents like that, it is.
It's pneumonia.
Exactly.
Okay, interesting, that one. So we'll be taking a look at some of the myths and misconceptions that people have or people would say about pneumonia in a very short while. But before that, there's something you've mentioned. I'd love for us to also take a look at that. You've said, so about the symptoms. This is what I wanted to ask. You said sometimes it would present with coughing, but chest pains. So I've had many people complaining when they're having pneumonia, anasikia uchungu, but ni kama anasikia uchungu kwa mgongo. You can't really tell ni wapi, you know. So what exactly happens there?
Okay, so that's what we call pleuritic chest pain. So, and also referred pain. So it's funny how our body works in the sense that we've got different nerves in different areas. And sometimes somebody will be feeling a pain here in their shoulder, but the problem is the heart. Sometimes somebody will be feeling a pain here in their chest, but the problem is the stomach. And that is because of how our nerves work and our nerves are aligned. So sometimes you can have a bit of referred pain. That is when the nerves in one place will refer pain to another place where it's connected and you're feeling pain there. But then also the chest pain that we have also when it comes to pneumonia, it's not really specified to one specific spot. And that's because it can either be, now this will now take me down to really medical jargon, but let me just say, that the exudate or the fluid or the presentation can cause inflammation in multiple areas. And the
So you don't have to be the lungs.
No. It will be in the lungs, but multiple areas around the lungs. So that's why you will be feeling pain in different areas in the lungs.
I see. So would that be among the first presentations of pneumonia?
Yes and no. One of the things that we say is diseases don't read books. So, sometimes the first presentation. Well, the funny thing is that you can have somebody who has an atypical pneumonia. So basically, the only thing they're feeling is tiredness and fatigue. But the first presentations, I would say it's cough. Yes, sometimes chest pain, and you will have what we call productive sputum. If it's bacterial, viral, you will have a dry cough and fatigue and hotness of body. Those will be your first presenting signs and symptoms. Yes.
So would you say, you said we have a type of pneumonia that is viral, so that is the baridi generally. So would you say baridi is majorly the cause of pneumonia to most of the people? Because I've had most of the people do get pneumonia when it's cold, during the cold season. So would that be the main cause of pneumonia?
No, not exactly, but I would say, yes, I don't read books, but it is one of the major, how do I put it? It creates the correct conditions for pneumonia to thrive. So instead of it being a cause, it will more or less be a risk in terms of if you're in colder areas, you're more susceptible. And that's because of three main things. Number one, when we're in cold, see, all of us are in one room together, right? We're in closer, less ventilated areas. So that will allow now for the spread of diseases, because pneumonia is transmitted through aerosols if it's infectious, or through other things. If it is not infectious, something called aspiration pneumonia. Yes, but if we're in closed environments, poor ventilation, we are more likely to spread one to another. That's number one. Number two, there are a lot of theories that have been put forth. One of them is that because we don't have as much sunlight exposure, that we don't get as much vitamin D, which is very important and vital for our immune system.
That's a true analogy, right?
Yes.
Okay. Because I've had parents telling kids, Tokeni mkaote jua mna need vitamin D.
You need that vitamin D. One of the funny things during COVID, part of the medications we were giving was vitamin D supplements to boost people's immunity. Yes, so yes, it is one of the other theories that is postulated. Also, as we said, we typically have the bacteria and viruses are incubated more, meaning they don't die as quickly in cold seasons as opposed to in hot seasons. So because of all of this, it creates the perfect conditions for pneumonia to thrive. So instead of it being a cause, let's just say it's a very good Airbnb for pneumonia.
Okay.
Yes.
Now let's take a look at the mythbusters because you have some of the myths surrounding pneumonia. So we'll be taking a look at that, just to get to know what are some of the myths. And then Doc will be telling us, is it true or is it not true? I think the first one, you've just mentioned it now, that pneumonia is always caused by cold weather.
Yeah.
So you said it's a good Airbnb
for pneumonia. It's an Airbnb for pneumonia, but it doesn't cause pneumonia itself.
So during this cold season, please dress well. Be warm. Now, Pio may mention what was the room should be well ventilated.
Exactly. Be in well ventilated rooms. If you're in a bus, open the window. Yes, take in some good fresh air.
I'm okay in a mask.
Yes, exactly. Wear your mask.
Okay. And the second one of the mythbusters is that only young children and elderly people get pneumonia.
Big myth. Very big myth. Now, back to the study that I was telling you about, it was actually carried out in Bondo in Kenya between 2001 and 2003. And they categorized around 2,500 patients that had pneumonia along that time that were hospitalized. And in that study, there were the first category of people that were infected or that were affected and that died was first and foremost children, those under 5. But secondly, which was interesting, was those between the ages of 20 and 29. That they actually accounted for 11% of the deaths secondary to pneumonia, which was a very interesting study to read. So it's not only the elderly and the very young. It is anybody can get pneumonia as long as the conditions or are correct, as long as your body is not, you've been in contact with pneumonia, as long as your body system might not be fighting it as well, you can get it. It's not just for the very old, it's not just for the very young. That's why you have a lot of mothers who have been nursing a sick child also get pneumonia. So yes, it's not just for the young and the very old.
Okay. Okay, let's take a look at the third one and then I'll go on with the third question. I've seen someone asking a very interesting question here and you'll be getting to that. So the third one is that pneumonia is the same as the flu or a severe cold.
Well, let me say yes and no. So what we call the common cold or the common flu, it's actually a particular type of virus. It's the influenza virus. And that is a kind of pneumonia. Yes. But the common cold, I would say, let me say yes and no. So yes, we can, the viral pneumonia can be the common cold, but we call that now our upper respiratory tract infections, the common cold. So it has not yet gone all the way down to the lungs. Once it reaches the lungs, now we've got pneumonia. But you can have an upper respiratory tract infection, meaning it's in your trachea, in your bronchus, in other places basically, and it's not yet gotten to the lungs, so you don't yet have pneumonia. Yes, so there's a thin line between the two that it has to be differentiated now from the medical perspective.
So would the flu, then prolonged flu, cause pneumonia?
Yes and no. I would say, let me say they can be interchangeable. Just basically say if it is above here, it is not pneumonia. If it's below here, it is. Let's just put it like that. That if it's a lower respiratory tract infection, then we will call that pneumonia. As long as it's entered into the bronchioles or the alveoli, or in the interstitium. Those are just very big medical terms, but the lower part of the lung, the lower part of the lung, it is pneumonia. But if it's an upper respiratory tract infection, then we're not yet classified as pneumonia.
Okay. And we've heard about so many people getting pneumonia, and they generally don't go to hospital and it happens that they get well. How does that happen?
So that's why when you go back to curve 65. So curve 65 is what we call the criteria, or how we measure the severity of pneumonia. And it's got 5 different things, and it's mentioned by the letters CURB curve and the age 65. So patients or people can present with confusion. Yes, pneumonia can cause confusion. Yes.
All right. Does it affect the brain? How does it cause confusion?
Well, it's a that topic is kind of up for discussion in terms of how the confusion ends up being caused by pneumonia, but it is seen in very severe cases. Some believe it's secondary to septicemia, meaning not necessarily that it affects the brain, but it causes so much depression that the brain ends up getting a bit of delirium and confusion. So there's confusion, there is uremia, so basically it will cause your kidneys not to work as well. Yes, your blood pressures can go low, so that's your B. You can start breathing very fast. That's the R, your respiratory rate. Or you can even have what we called a lower oxygen level. Or so that's the R. And finally, above the age of 65. Now, once we score you on this curve 65, it's a score from 1 to 5. If we score you on it and you have a low score, you can walk around and take your medications and continue on with life, because we're confident that your body will fight it together in combination with the medications once you have already been able to diagnose the type of pneumonia that you have. But then if we score you and you've got a higher score, meaning a score of 2 to 3, we might either want to admit you for a short period of time, that's called moderate risk, or if you have a score higher than that, you might want to admit you even to ICU, because you have a severe disease. So it is very possible those who have got very good immune systems that don't have any complications of pneumonia, you can just take oral medication and continue on with your lives. However, if you fit into the categories that I've specified, then you might need to be admitted.
But it doesn't have to be for a very long time, as you say?
Not necessarily. If you don't have a resistant type of pneumonia, if you've got something that is very common, that is very treatable,
you're good to go.
You're good to go.
All right. Now, we'll be getting the Vox Pops to just hear what the people think about what causes pneumonia, because you've had so many discussions around what causes pneumonia, especially for the young babies. You said under 5 are very at risk, highly at risk of getting pneumonia. So we'll be getting the Vox Pop so that you'd hear from the people, what do you think causes pneumonia? And then, of course, you'll be getting back to us on whether we are right or wrong. Ama tuko mahali karibu. Right?
Yes.
Okay. Okay, before we get to that, maybe, there's something you had mentioned. We'll be getting the Vox Pops in a while. But there's something you had mentioned about you're very concerned when you have pneumonia and cough, you're coughing blood. What would that mean?
So it could mean a lot of things, but the one thing we're mainly concerned about is TB. Tuberculosis. So tuberculosis, it will present with the coughing out of blood. So one of the major tests that we do will take your sputum, so that mucus that you cough, and we'll take it for a test called a gene expert to check whether or not this disease that is infecting your lungs, is it tuberculosis or is it any other type of infection that is going on. And it's very easy for us to get what we call misdiagnosed. They say common things occur more commonly. However, they can sometimes cover what is uncommon. So for instance, you could have another underlying illness, and because of that underlying illness, you're coughing blood. But because everybody is treating pneumonia, you'll just be given your antibiotics. We will not figure out that you've got lung cancer. We will not figure out that you've got something else, or bronchiectasis, or something else that is going on. So that's why it's very important that if you're coughing blood, don't sit at home. Please go to your nearest facility and figure out why you are coughing blood.
Okay. Well, would pneumonia cause lung cancer though? Prolonged?
No. Pneumonia,
good news.
It's not going to cause lung cancer.
All right. Perfect. Let's get the Vox Pops just to see what we know about pneumonia, the symptoms, the causes, hizo zote. Let's get to it.
Dungandungwa kwa mbavu, kusikia umekosa pumzi, saa nyingine unasikia mchofu na uchungu kwa kifua kiasi.
Pneumonia inakosiwa na kuinhale baridi, so unapata una feel pain in your chest, and huwa inaenda backwards. Like for me, for example, I have those signs. Yes, so nimekuwa nikienda hospitali, daktari ananiambia ni signs ya asthma, but it's very dangerous by the way. Juu ikikupata huwa unasikia uchungu hapa kwa mgongo, unasikia ni kama kuna kitu inakudunga kabisa, alafu inaenda mpaka kwa ribs. Even to breathe it's so difficult. It's very very bad and very very painful also here. Hapa kwa mabega unasikia kuna nini na kudunga dunga. So naweza advise tu mtu jikinge tu baridi. Pia avoid penye kuna vumbi, upepo. Hata kama umepanda pikipiki, jaribu kujizuia baridi. Jifunike tu na even a mask saizi inaweza help.
Like coughing, fever, headache, backaches and all that, yeah.
Sweat sana, kama una sweat sana, najua hiyo ndio symptoms kwanza.
Fever, na chest pain, na sometimes difficulties in breathing.
All right, so that is it about what people think about the same. And we've had most of the people saying, unasikia uchungu fulani, kama unadungwa kwa mgongo. For most of the people, I feel like that's how it presents.
Yes.
So people have mentioned about coughing, they've mentioned about difficulty in breathing.
Exactly.
So they're right there.
They are very right. That is exactly how pneumonia presents. The pins and needles, the way she was saying, kama kisu medunga. Yeah, that is literally textbook pleurotic chest pain. So yes.
Okay.
Yes.
But there was one who's mentioned about alienda hospitalini, akaambiwa ako na asthma. Is asthma and pneumonia related?
Yes and no. So asthma itself can be, it's a disease in itself. It's got its whole type of pathology, type of presentation. But pneumonia can do what we call exacerbate asthma, okay? Or what we call an acute asthma attack. So if a patient who already has, or a person who already has asthma gets pneumonia, that's when it will now cause their asthma to have an acute reaction. So that's when they will they'll start feeling as if they're having chest congestion, they can't breathe, they start wheezing, and that becomes very dangerous for somebody who is asthmatic. So pneumonia doesn't cause asthma, but it can cause an acute exacerbation of asthma, or an acute asthmatic attack, as it is called.
Okay. So you've said for the people who have asthma, they are at high risk. So if you want to issue kidogo, make sure you go to hospital.
Exactly.
Make sure you go to hospital. Now, this is just to remind you that our numbers are very open. I see we have questions coming in already. So if you have any question that you'd want for us to tackle, please feel free. Our WhatsApp number is 0721 105 105. Our SMS code 23814, which is absolutely free, by the way. We are live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. Sawa. So on all those social media pages, you'll be able to ask your questions and we'll be getting it. But also on all my social media accounts on Rachel Kahugu with the hashtag Afya Clinic, we'll be able to get your messages as well. So nasema, hi Rachel. You're doing very well. Okay, nimeona ujumbe wako. Today we are talking about asthma. Asante sana, God bless you. Tukuna mwingine anasema good morning. Good morning to you too. Anasema hi. What are the risk factors for pneumonia? Risk factors for pneumonia. Is there something like risk factors for pneumonia?
I don't know if they mean risk factors or rest factors.
Okay.
If it is risk factors, I think we've mentioned them already.
Yeah.
There is the age. There is, yes, for instance, the age in terms of how you are presenting, the very young, the very old. If you have any other infections, as we've already mentioned, if you've got asthma, COPD, cancer, HIV, diabetes, you're at high risk, cold conditions, cold areas. Yes, those are the risk factors. Or being around people who have pneumonia and you have a compromised immunity, those are the risk factors. Risk factors, I'm not sure what they mean by that.
There might be an issue there. So Nana, kuna mtu anauliza about other complications that one can have from pneumonia, like COVID, and for example, COVID. So would one get COVID from pneumonia?
No, I don't. It doesn't work like that exactly, because COVID in itself is a type of pneumonia. So it's not that you're getting COVID from pneumonia. It is COVID that is causing your pneumonia. As you said, there are different type of causative agents. So one of them is viral, and now the most popular virus right now happens to be COVID. Yes. So basically, the complications. COVID was very unique in its in the set of complications. So if you don't mind, I'll just say the complications that might arise from other pneumonias, and then I can also specify on the ones we saw in COVID. So other pneumonias, the type of risk factors, that complications that we would get, there's something called pleural effusion. So that basically means, how do I put it, between your lungs and your rib cage. So your lungs and your rib cage, you have a thin film there called what we call the pleura. It's a thin sac that houses fluid. And in this thin sac, this fluid helps ensure that your lungs can expand and relax without any friction caused. Now, if you've got an infection, a severe infection, there can be a build up of that fluid in the pleura, in the pleural cavity. We call that pleural effusion. So basically, you will have a lot of fluid in your lungs. And this is not fluid in the air sacs, it's the fluid surrounding your lungs, and it will compress your lungs and you won't be able to breathe well. So that's one of the complications. We'll have pleural effusion. Another one is that you can get lung abscesses. So that basically means instead of just the simple fluid of secondary to inflammation, pus will be inside your air sacs or your alveoli. Yes, you can get pus in your lungs, and that can cause very severe complications, and it has to be removed in certain cases. That if it's a massive amount of pus, it has to be removed in order to be treated. So you can get lung abscesses, you can get pleural effusion. You can get what we call sepsis as well. So that means that instead of it being an infection localized in your lungs, it will be an infection that can spread throughout other places of your body. And especially in those high risk categories that I've mentioned severally, they are at a high risk of developing what we call septicemia or bacteremia. Basically, the infection moves just from your lungs to other areas in your body. It can create a bloodstream infection, and it can be actually very fatal if that happens. Now, some of the specific complications we saw in COVID that were quite unique, there were two things that I saw, especially during that time, and that is something called a pulmonary embolism. Now, a pulmonary embolism, it's a clot. So clot is when blood comes together, right? For instance, if you cut yourself, you can sometimes see blood coming together at the surface. So now getting that clot at the level of the lungs, and that is very dangerous because it blocks the pathway of air to that particular area. So that clot will block the pathway of air to that area, and the person will have difficulty in breathing, and it can also be very fatal. So a lot of people who had COVID ended up with emboli in their lungs or blood clots in their lungs. Another thing that we saw in COVID that was very unique and very different from other presentations of pneumonia is something that we called post-COVID fibrosis, lung fibrosis. So now fibrosis is what we call scar tissue. So usually when you get a cut on your skin and it heals after a period of time, you can see a small scar afterwards. So that when your skin heals, you'll see a scar. Now that happened at the area of the lungs now for people who had pneumonia. So there was scar tissue in the lungs, and because of scar tissue now that scar tissue does not function as the normal tissue in your lungs. So it doesn't doesn't, it worsens the function of your lungs, and therefore people who had COVID, a lot of them became very dependent on oxygen. Yeah, so I'm sure you, that's when a lot of people learned about pulse oximeters, the little machine that we used in order to measure oxygen levels in people's bodies. It's because they became dependent on oxygen, because COVID really damaged their lungs and they were no longer able to function as normal. So those are a few of the complications of pneumonia.
All right. Now I've understood why some of the people who actually got off from COVID, walirudi nyumbani, but they still really depend on oxygen.
Exactly. Exactly.
Yeah. Okay, I see. And I sweat a lot at night. Could it be the cause?
Now, night sweats, well, night sweats, yes, it could be a cause of infection, but it's also very characteristic of what we call ATP, acute tuberculosis pneumonia. So TB presents with hotness of body and night sweats. Yes, so if the person is coughing a lot, if they're having night sweats, it's not necessarily TB, but it is a high risk factor. It makes us worry as physicians, as doctors, whether or not the person has TB. So it could be a cause of an infection ongoing in the body, but it's not only pneumonia that could cause that. Even malaria could cause night sweating at night. Other infections in the body can cause that. But it would be wise for them to go and get checked up. If you're sweating at night, go to hospital and ask the doctor why.
But we'd love to know, apart from sweating at night, do you have other symptoms? Ama ni kusweat tu usiku? Because would you have that as the only presenting symptom for a disease?
No, not only. So exactly what you're saying, you would want to know what else is going on apart from sweating at night. Are you having headaches? Are you having joint pains? Are you coughing? What type of cough are you having? Is your chest paining? Apart from sweating at night, is there anything else going on in your body? Those are the questions that now we will ask as clinicians.
I see. I see it's almost 9. We have 9 minutes to... No, 5 minutes to 9. So I know we'll be taking a very short break. But before we do that, maybe you'd answer a lady here and say, good morning.
Good morning.
I say, I have been having sharp pains in my chest and lots of sweating at night. Will I be having pneumonia?
I would ask her, are you coughing? Where is the pain specifically? Because remember, your chest, it's a very vital place in your body. It houses not only your lungs but also your heart. So we have to also be able to differentiate: is this pain coming from the chest or is it the heart? So are you coughing? Are you producing any sputum? Are you having any mucus coming out from your mouth? Are you having a hotness of body? If all of these things are true, I would say it's a possibility that you are having pneumonia, but I would highly encourage you, go get yourself checked out.
Now, how would you know that it's your chest paining and not your heart? Is there a way, without going to a clinician, you'd know? Because I've had most of the people,
typical Kenyans.
Must. So we'd love to know, is there a way I'd know this is just a chest pain? No, this is actually an issue with the heart.
Well, the way the heart and the lungs are so close together, it's kind of difficult to differentiate, even as clinicians, to know, hey, natoka kifua ini roho, ini moyo. Yes, so it's kind of difficult, but the character of the pain is what will help us differentiate. So the character, basically, as we've said, pleuritic. Basically, is it worse when you cough? Is it worse when you breathe? That will tell us, and is it usually it's sharp, like pinpoint pain, like needles are poking you. That's typically chest pain, and it's in the chest areas. If it is dull pain, people say ni kama mawe, that they feel as if like a stone is on their chest. That is something that is typically characteristic, or even a squeezing pain, something that's squeezing you. That is typically what we would say is coming from the heart. However, I wouldn't say please don't be your own doctor at home. You can say this is pneumonia and you're having a heart attack, so please, please don't do that at home. Don't try it at home.
All right. So make sure you go get checked if you have any issue. Sawa? So we'll be taking a very short break and then we'll be coming right back. Just to remind you, this is Afya Clinic. where we talk about everything health. And today we are talking about pneumonia. So if you have any question, ama kuna vile una feel you have some pains in your chest, ama kuna shida kidogo with breathing, ama anything, and you feel in regards to pneumonia you'd want to ask today, please make sure that you do ask. As we've said, our numbers are very, very, very open. Sawa. So for now, we'll be getting Healthy Living by the one and only Sylvia Wanja, and then we'll be taking a break. Tukirudi, we'll be continuing with the topic as we wind up. So if you have any question, this is the time to ask. Sawa. So Healthy Living by Sylvia Wanja.
Hello and welcome to Healthy Living. My name is Sylvia Wanja. Today we're going to talk all about preventing pneumonia. Preventing pneumonia involves a combination of vaccinations, good hygiene practices, lifestyle habits, and awareness, especially for people at higher risk. Pneumonia is an infection that inflames the air sacs in one or both lungs and can be caused by bacteria, viruses, or fungi. Here are some key ways to prevent pneumonia. Number 1, vaccination. Get the pneumococcal vaccine. Helps protect against the most common bacteria cause of pneumonia. This vaccine is especially recommended for young children and older adults, that is 65 plus, and those with chronic illnesses or weakened immune systems. Number 2, practice good hygiene. Wash your hands frequently. Frequent hand washing with soap and water, especially before eating, after using the bathroom, or after coughing or sneezing, helps prevent the spread of germs that can cause respiratory infections. Cover coughs and sneezes, and then avoid close contact with sick individuals. Try to stay away from people with respiratory infections. If you're sick, avoid close contact with others to reduce their exposure. Number 3, maintain a healthy lifestyle. Eat a balanced diet rich in fruits, vegetables, and lean proteins to help support the immune system, making it more effective in fighting infection. Regular physical activity also boosts immunity and lung health. Drinking enough water keeps your respiratory tract moist and help mucus flow, which can flush out germs. Adequate sleep is essential for immune function and recovery. Number 4, strengthen your immune system. Consider supplements if needed. If deficient, vitamin D or C supplementation may support immune health, but consult a healthcare provider first. Number 5, regular medical checkups. Especially for those with chronic health conditions, regular checkup can help monitor lung health and identify potential issues early. By following these prevention tips and staying vigilant about respiratory health, you can significantly lower the risk of pneumonia.
MBCI Television, transforming lives.
At least
Aliye kando.
Shut up everybody. Listen.
Mungoja chini. Mungoja chini.
Wewe umejanjaruka, utasemaje kwa kizungu?
It's about to go down.
I am janjaruk.
You what?
I
am janjaruk.
Hey!
Aliye kando?
Ajembere. Ajembere.
The second last book wa Old Testament ni gani?
Old Testament?
Yeah.
Zakaria.
Nipatie spelling ya neno geography. Geography.
Quiet.
J-O. I.
Here's to the ultimate family day out. MBCI Media and Kingdom Premier International Schools presents the Nakuru Family Festival happening on the 30th of November 2024 at Cypress Park, Nakuru. From thrilling games, non-stop excitement, delicious foods, there's something for everyone. And that's not all. We are excited to have the incredible Moji Shot Baba as our guest musician, bringing the energy. Grab your advance tickets now for only 899 shillings for kids, games and lunch inclusive, and 200 for adults inclusive of our refreshments. Get tickets will go for only 1000 shillings for kids and 250 shillings for adults. Grab your tickets today on MadFun by dialing *672*55# or www.madfund.com. For group booking, call us on 0759 325 735. See you on the 30th of November 2024 at Cypress Park, Nakuru for the Nakuru Family Festival. Be ready to spin and win with KCB Cab account. Lots and lots of prizes.
But I know highly favored.
MBCI Television, transforming lives.
All right, we are back after that very short break. And of course, now this is where we get to read all your feedbacks, hoping time will allow us. And just to see and hope we'll be able to answer all your questions. Just to remind you, this is MBCI TV, ambapo tunabadilisha maisha by the grace of God, and the show on air is the one and only Afya Clinic, where we get to talk about everything health. So if you have something that you want us to talk about in terms of health, please, you can always text us through our numbers, especially WhatsApp for that. WhatsApp, that is 0721 105 105. Sawa. So yeah, so that's it. Now we're reading some of the feedbacks. Nanona, we have Heathen. Heathen, good morning. Is it good night? Zote. Sema. So Nigeria, Democratic Republic of Congo, that is DRC, and Ethiopia report some of the highest pneumonia mortality rates, especially among young children. What could be the reason?
Okay, so that's a very interesting question. That shows somebody has been reading about epidemiology. Yeah, but that's a good thing to be well informed. Now, the reason why not just these three specific countries, but developing countries as a whole report higher rates of pneumonia and higher rates of mortality secondary to the same. Number one, it's because of infrastructure. So we have poor infrastructure in our in developing countries, and therefore there is not as much access to medications, there's not as much access to healthcare, and what we'd call the life-saving methods to help treat that pneumonia for people in those countries. So infrastructure, number one. Number two, specifically for DRC, unfortunately there's been conflict going on in that country for a long period of time, and in conflict-stricken areas they find you will definitely find higher rates or higher risks of certain diseases, especially pneumonia, that will occur because they do not have access. Because of the conflict, they do not have access to antibiotics, they don't have access to certain care. So those are some of the reasons. And finally, because of that, I would say, also the general population well-being in terms of health, in terms of malnutrition. That could be a factor that would worsen malaria, which is more in developing countries as opposed to those less developed. You will find people living in crowded areas more so in developing countries than in those that are developed. So those are a few attributes that will worsen the mortality rates. And finally, also, we have, especially on our continent as a whole, an emerging problem called poor antimicrobial stewardship. So that basically means that everybody's being given an antibiotic by every chemist. You walk into a chemist, you will live with some sort of antibiotic, lazima. And because of that, we are getting what we call resistant strains of pneumonia. So the pneumonia that was back in the day that was reacting to penicillin is no longer reacting and responding to the same because we've overused and over-abused a lot of our antibiotics. And this is worse and more so in those war-torn areas or places where there is a high density of population like Nigeria and Ethiopia.
And I'll be introducing what we'll be doing next week in a few, because we'll be talking about that. How comes most of the diseases are now not treatable using the same medications that you used to treat them like 2-3 years ago? What has happened? Why is it that you're having our bodies become more resistant to drugs? We'll be talking about that. But for now, there's a question here. How fast can pneumonia kill?
Well, that depends. Now, as we said, books don't, diseases don't read books, but it really depends on a person-to-person basis. If there's somebody who has a really immunocompromised, meaning there can be a patient who is in ICU, they are intubated, and then they get what we call a ventilation-associated pneumonia. Basically, they get a severe pneumonia because of intubation, and they their body cannot fight against it, they can die very quickly because of the same pneumonia. You can find somebody else who has got a better immune system, but they've got a resistant strain of pneumonia, those pneumonias that doesn't respond to the typical antibiotics that we have. So it can take a very short time for those who have other diseases, or pneumonia can actually even worsen some diseases, especially those who have got poorly controlled diabetes. Pneumonia can cause what we call diabetic ketoacidosis. It will be the infection that will worsen your diabetes, and that could eventually kill you. So it's on a patient-to-patient basis. It can be a day, depending on your presentation. I would say a day from being admitted to hospital, because we can only garner from that time. But from your presentation of pneumonia, it usually takes around 2 to 8 days for it to incubate in your body. So yes, 2 to 8 days for it to incubate in your body, and for you to present with the different symptoms. Yes, we go to your red hepatization, gray hepatization, all of these very long medical terms. But until the consolidation phase, it can take from 2 days to around 8 days, up until 3 weeks. Yes.
I see. So the earlier you go to hospital,
the better.
The better. Yep. Are there home remedies that would help with pneumonia treatment?
Yes, they are. Let me put a disclaimer before I start. Exactly. Let me put a disclaimer before we start giving home remedies, because people will say, Daktari said that we can use this instead of using medication. So please, number one, go to hospital, seek professional help, number one. But there are other methods that will assist with the symptoms of malaria. So not malaria, pneumonia. So they would treat the pneumonia itself, but it will help alleviate the symptoms of your pneumonia. So some of those home remedies, or let me just start with the basis of keeping yourself warm, taking hot water, that will help to thin your mucus, that will help being able to cough out and decongest your body. Having humidifiers at home, that will perform the same function as yes, the hot water. Then there are the things that we typically use. Our grandparents were not wrong in giving us our honey, our lemon, and our our ginger. Now, what your honey does, it also performs the same function as hot water, but it also soothes the throat. So if you have a sore throat, your honey is very good for that. It will also help with your decongestion. Your lemon has vitamin C. Vitamin C is very important for your immune system, so it will help boost your immune system, and it has a minor bit of antimicrobial function. I will emphasize on the minor, because they will start using lemons instead of antibiotics. And also we have cloves. Cloves are anti-inflammatory as well, so people can add some cloves in your tea. It will help with your inflammation. It will also help with a bit of the pain that you would feel. And your ginger has the same function as cloves, anti-inflammatory, and it will also help with the pain that you might be feeling secondary to it. So you can use a few of these home remedies, but don't let it be a substitute. Please do not allow it to be a substitute for medication and for an authorized clinician to see you.
Now, you've mentioned about lemons. Last week you were talking about peptic ulcers. And we mentioned that if you're having peptic ulcers,
don't take lemons. Exactly.
So what do you use as a substitute for that? Ama sasa kama uko na peptic ulcers, if you have pneumonia, go to hospital.
Go to hospital. Stop trying to avoid doctor. Just go and see somebody. But if you've got PED, you can omit the lemons as well. The function basically for it, as we said, it was just a slight bit, a minor amount of anti-inflammatory support. It helps with your mucous membranes, but it's not much that you will lose by not using the lemons. You can use your honey and ginger alone. Stay away from the lemons if you have PUD. I would insist.
Okay, I see. Now, we are winding up, and I know that we'll be giving an answer for a number rather. For anyone who would want to ask more questions on the same. But before we finish up, I see Anauliza, hi Daktari.
Hi.
Asema, is it possible for someone who has, right, so is it possible for someone who has peptic ulcers? I think you're asking about last week's topic, peptic ulcers, but we'll connect you with the doctor ambaye alikuwa amekuja about peptic ulcers, but maybe you can just answer it because why not? Here. So Liza, is it possible for someone who has peptic ulcers to cough blood? Ile ameandika vile anataka bado worry, will just answer. Yeah. So while coughing, you cough blood. Yeah, or rather blood.
Yes, it is possible for somebody with peptic ulcers. There are two different ways that can happen. So the first way is it's not necessarily coughing, but it's vomiting, or what we call regurgitation. So you can vomit blood if you have peptic ulcer disease. We call that hematemesis. So that is the vomiting of blood. And that basically means your ulcer, basically as it's eating away the lining of your stomach, it might hit a capillary, which is a blood vessel, and then you'll end up vomiting or regurgitating blood. And it can even just be coffee ground vomited, so it looks like your grains of coffee in your vomit. So yes, that is possible. And then that is the first thing. And then secondly, you could be having another illness that is now causing you now to cough blood as opposed to vomiting blood. Case in point, we've had people who have who are alcoholics, and they have ulcers because of alcohol, but they also have TB because alcohol depresses your immune system. So you have more than one illness going on, and that is why you end up coughing blood. So if you're coughing blood, daktari tafadhali nakuomba, because what that does in the long term, if you're losing blood, especially from your stomach, you will have a reduced HB or blood levels in your body, and you will need that to be replaced. And that can be very, very fatal if it's not replaced in time. So please do go see a health professional as soon as possible.
So in fact, just avoid alcohol at all costs, because we've seen it's causing a lot of illnesses. In fact, it's also causing issues in the families. It says, why are you taking alcohol? Mtakosana hata na God buri. Just stop taking alcohol. Kabisa. Sawa sawa?
Yes.
Yeah. So you had talked about asthma, because I see someone is asking about asthma. Last question, please, and then we'll give a contact. Okay? So would you maybe tell us what really causes asthma? Because we've also seen if you're having asthma, then pneumonia you might be at very, very high risk of getting pneumonia. So what causes asthma?
So asthma is basically the body fighting, overreacting. You know those people that you might hit them kidogo and they have such a huge reaction and you're like, what's going on? That's exactly what asthma is, but it's at the level of the lungs. It's an overreaction of your immune system to something that is not necessarily a pathogen. So it's recognizing something as an enemy that should simply be coughed out. So if you get a bit of dust, if you get a bit of pollen, yes, if you get certain chemicals inhaled into your lungs, your lung will have an overreaction and it will cause inflammation of the lungs, and it will cause what we will call the bronchioles to close up because it is now inflamed. So you're breathing normally when your bronchioles are open, but then you start to wheeze because they're closing up, and you start getting congested because now you are closed up. Now that is caused by because of several factors. Most of them are genetic, so it's genetic and idiopathic. So basically, you were born with a specific genetic change that has made you susceptible to asthma. And then there are also other idiopathic things. There are also certain things that will exacerbate or worsen your asthma, so like pollen, as we said, dust, some mites can cause worse exacerbations. So those are the things that would cause asthma. Now pneumonia will worsen your asthma, because remember, pneumonia, we said Feyan, so it is lung inflammation. So it is doing it's inflaming the lung first, and then your body is overreacting on top of that. So you're having two overreactions at the same time, and that is why it becomes so fatal. Yes, for your lungs, and you're having both lung congestion and then there's fluid in the lungs. It becomes a bit too much for your body to work out. So that's why if you're asthmatic and you've got homa kidogo, don't see it as homa kidogo, tafadhali. Go get checked. Yes, go get checked up. Exactly.
Okay, I see. Sasa hata tumefunga tap. Now, For the people who would want to consult more, or people who would want to come get checked, as you said, wasikae nyumbani, wakuje hospitalini, where would they find you?
So I am in Nakuru County Referral and Teaching Hospital, more commonly known as PGH. You can find me there. You can on social media, you can find me as Ms_Sharon Kimani, and then I'm sure the number for PGH has already been put up. Yes, that's where you can find me.
Perfect. So the contact PGH is on the screen right there. So if you need to ask any question, I'm sure there's someone there who will be able to answer.
Yes,
right?
definitely.
And you've said on Instagram for anyone who would want to ask a question,
they can go to Ms_Sharon Kimani. Yes,
Sharon Kimani.
Yes.
Perfect. It's on your screens as well. So if you have any question you'd want to ask her specifically, that's on Instagram. But also you can always find her on PGH.
Yes.
Wapi exactly?
I work in the Nyayo wards in the internal medicine department or in the specialist clinics in Block 7. Yes.
Perfect. Thank you so much for coming.
Thank you so much for having me. This was lovely.
Right?
Yes.
We've had a really good discussion.
Yes.
And talking about pneumonia, and it is very important for all of us to understand that a cough is just not a cough. You need to go get checked.
Yes.
Na tuache kukua wale wa Kenya wa kukaa nyumbani until worst gets to worst. Okay? So ukifeel kuna issue kidogo, go get checked. Umesema umeita cabs 65.
Yes.
Umeshika. Yes, you said cabs 65.
Yes.
So you go get checked. Kuna wenye hawata have go admitted in hospital. You might get admitted, but for like 1-2 days, something.
Yes.
But ukikaa nyumbani sana and it gets to the worst, then you have to be in hospital for quite some time. But the good news is pneumonia is treatable.
Yes.
Right?
Yes.
Perfect. Your parting shot. What would be your parting shot?
My parting shot will be, let's not take the simple things lightly. Pneumonia, it's a very common disease, and that means that it's a very studied and very treatable disease. But please don't be one of the few percent that stay at home too long, that present too late, and we end up not being able to save you. Your life is worth more than just a trip to the hospital. So please do go, do get checked up. And also, if you know you fall at risk, if you're in the at-risk community, please make sure you do not treat any cough too lightly.
Okay. Thank you so much. I see we still have questions coming in, but maybe you can just answer moderator Dina. And is it true that persistent pneumonia can cause pierced lungs?
Pierced lungs?
Yeah.
Oh, okay.
No,
so I think what they're asking is if you get recurrent pneumonia, if you can end up getting cancer.
Maybe.
Yeah, I think that's what they're trying to ask. And, well, not exactly. If you get recurrent pneumonias, you can get something called lung fibrosis. Lung cancer, there are other risk factors for it. For instance, smoking. For instance, smoking actually is the #1 risk factor.
So do not smoke.
Yes, you don't smoke. Exactly.
Do
Smoking.
not.
Exactly. That's another thing we should have said. Avoid alcohol, avoid smoking, because those really worsens your lungs. But yes, so smoking would cause lung cancer. Recurrent pneumonias can be a symptom of lung cancer. Yes, because of that weakened immune system, because your lungs are no longer functioning as normal. It is very easy for pneumonia or for an infection to settle, yes, in your lungs. But recurrent pneumonias can cause lung fibrosis, as we spoke about in with COVID. If you're having multiple infections, you're getting scar tissue over and over and over again. And because of that, yes, your lungs are getting more and more damaged. And you can end up with something called chronic obstructive pulmonary disease, or COPD, because of recurrent and repetitive infections, a damaged lung, basically.
That was such a bad scenario during the COVID. I don't think I'll ever forget.
Yes,
God
none of us will.
That.
Amen.
Ever.
Yes.
It shouldn't happen again. Sindio? Others, asante sana for coming.
Thank you so much for having me.
Appreciate. Yes, and then pale Instagram, ask questions. Go to hospital at PGH. Ask all the questions you want. Call if you need any clarification. The numbers zimekuwa pale as well. Tutakuwa naziona. So that has been it today on the topic pneumonia, but of course we are not done until we get the pointers. So what has been your take home from when it started? What has been your take home? So wacha tuzione pale. So these are some of the things ambazo we have gotten from today's discussion. Of course, clearly I need kukula carrots vizuri, right? So one is that pneumonia is a lung infection that can be caused by bacteria, viruses, or fungi, leading to inflammation of the alveoli of the lungs. Yes, so that is one. Number two, that is right? Yes. So these are take homes that we've taken from today's discussion, but of course you can continue sending more through our numbers. So the second one is that symptoms include coughing, rusty or bloody sputum, difficulty in breathing, and general body fatigue. Kwanza ya general body fatigue. Utasemanga tu nimechoka, I need some rest. No, you need to go to hospital. Yeah. Number three is that major types of pneumonia are community-acquired pneumonia and hospital-acquired pneumonia. And you say that hospital-acquired pneumonia is a huge, kuna many subdivisions.
So many subdivisions.
Yeah, so you need to go to hospital.
Also called aspiration pneumonia.
Okay.
That also needs to be added for those who have strokes, those who are alcoholics. Yes, those who have CNS depression, those who have epilepsy. So basically, they can aspirate some food, and that food which has microbes, because they're not able to cough or regurgitate that food properly, it can end up in the lungs and causing pneumonia. So that can also be part of the medial categories.
How is this supposed to be treated? You'll
That
have to remove.
No.
Oh, okay.
That we don't remove that.
Because what?
No. But in major cases it can be dislodged, but it's just treated with the same antibiotics and antivirals that are given. It's a bit more severe because it's usually lodged very deep in the lungs, and it's usually in people who are not able to fight infection. It's treatable.
All right. So yeah, and then the other one is that children, those with autoimmune diseases, and adults over 65 are most susceptible. Yes, susceptible. To pneumonia, and should seek medical attention at any sign. Just any sign of pneumonia symptoms. Sawa. And that cold weather does not cause pneumonia, but it creates the correct environment for pneumonia to thrive. Tulisema it's an Airbnb, pneumonia.
Airbnb,
so take care of yourself. Yes. And that pneumonia is treatable and can be treated through antibiotics, antivirals, and antifungal. Yes. So that has been it. If you have any more that you've had as your take home, please feel free to send in, share with the people. We learn together right here. Sindio. So thank you so much for tuning in today. Has been amazing. Yeah. So God bless you. Now we'll be getting the health. You know health what? Health. No.
Health show.
Perpetual Nyambura. Today we're talking about something. I'll be telling you that in a few. Yes. We're talking about almonds. Yes, we're talking about almonds, and we are getting that in the health tips. So today, ndani ya health tips, we'll be learning about almonds. Almonds is one of there's a time, I think 2 years ago, I was very interested in thinking about almonds.
Oh, wow.
Is it healthy? How can you take almonds? So today, you'll be getting to learn more about that, because I can tell you for sure, they're very healthy. So Perpetual Nyambura, our director, one and only, has made this specific segment for you so that you'll be able to be more healthy, know what you're supposed to take and when you are supposed to take. So today, we are getting ndani ya health tips, almonds. All right, so let's get into that, and then sasa tutakuwa tumemaliza. God bless you, God be with you. After that specific segment, I'll be coming back to give you some good news. So do not miss out. Sawa, let's get the health tips.
Leo mtazamaji wangu, katika makala ya Afya Tips tutakuwa tukiangazia umuhimu wa lozi kiafya. Lozi kwa Kiingereza kama almond iko katika jamii ya njugu na ina virutubisho muhimu zinazohitajika katika mwili wa mwanadamu. Ni chakula chenye kutia nishati mwilini na akilini. Kuna aina mbili za lozi. Kuna lozi tamu, lakini pia kuna lozi chungu. Mara nyingi lozi chungu hutumika katika mambo ya kutengenezea vipodozi, mafuta ya lozi au almond oil na pia manukato. Ndani ya lozi kuna vitamin B, calcium, mafuta, chuma, nyuzi, shaba na phosphorus. Vitu hivi vinasaidia katika upatikanaji wa hemoglobin na pia husaidia ubongo, mishipa, mifupa, moyo na ini kufanya kazi kwa wepesi kabisa. Lozi inasaidia kupanua na kutia nguvu misuli ya ubongo katika kuongeza fahamu. Utu uzima wa kiumri. Chukua lozi kiasi na uziloweke katika maji na baadaye utoe ngozi kisha uzisage kwa kutumia blender. Hii huongeza protini ndani ya mwili na hasa kwa watu wazima. Pia unaweza kutia katika maziwa kabla ya kunywa, lakini ni mzuri kwa watoto. Madini yaliyomo kwenye lozi yanasaidia mtu kuimarisha mifupa, misuli, viungo na kukabiliana na shinikizo la damu. Matatizo haya mara nyingi hujitokeza kwa wenye umri mkubwa. Shaba pamoja na chuma na vitamin hutumika katika mfumo wa hemoglobin ya damu. Kwa hiyo wenye tatizo la upungufu wa damu wanashauriwa kutumia lozi kwa wingi. Kwa wale pia wenye matatizo ya usagaji wa vyakula ni vizuri kula lozi wakati wa usiku kabla ya kwenda kulala. Lozi hukaangwa kidogo na huliwa kwa kutafunwa kama ilivyo karanga. Kitafunwa hiki kinachofanana na karanga kinatajwa kuwa ni tiba kwa watu wenye matatizo ya moyo na husaidia kwa kiasi kikubwa katika kuratibu mapigo ya moyo. Aghalabu huwa na manufaa mengi kiafya ukilinganisha na aina nyingine za njugu. Hiyo inatokana na kiwango kikubwa cha protini na virutubisho vingine kama vile madini yanayosaidia kuratibu na kuweka sawa mfumo mzima wa mwili. Pia mtu mwenye kisukari anapotafuna lozi husaidia kuratibu mfumo wake wa damu na kuhakikisha siku zote mishipa ya damu inakuwa inafanya kazi jinsi ipasavyo. Ni hayo tu kwa sasa mtazamaji wangu, tupatane Jumatano ijayo katika makala ya Afya Tips. Jina langu ni Perpetual Nyambura.
All right, we are back. So that has been it on the health tips, and now you know what you're supposed to do. Please eat almonds. It's really, really good for your health. Sawa sawa. Now, before we get today's Did You Know, which is very interesting today, I want to tell you guys about something. So on the 30th of November, 2024, that is a few days. Yes, a very few days. Maybe around 2 weeks. Yeah, around 2 weeks. So it will be the last Saturday of this month. We'll be having something really great that will be happening on that day, pale Cyprus Park, Nakuru. And I know that you've mentioned Cyprus Park mara nyingi sana. So this particular event has been brought to you by MBCI Media and KIPS, Kingdom International Premier Schools. Na najua mnajua hiyo shule pia. It's an amazing school, by the way. Plan on enrolling your kids there come January, okay? God bless you. So, on the 30th of November, we'll be having something beautiful happening there. That is the Family Festival, where you come to Jibambe. We've had an amazing year, and we thank the Lord for that. But now, after all that, it's time we just relax, be happy to maingia sasa the festive season. So, as you can see on your screens, that is what will be happening. Nakuru Family Festival on the 30th of November 2024, Pale Cyprus Park, Nakuru. So come with your kids, come with your siblings, come with your friends. We'll be having a good time right there. And Moji Shot Baba will be the guest artist of the day. So he'll be coming, tutakuwa tunaimba, tutakuwa tunakula. We'll be having a good time. And as you can see, advanced tickets go for only 899 shillings for kids, and then for adults, it's just 200 shillings. But ukingoja mpaka hiyo 30th, ukuje ulipie pale kwa gate. Itakuwa 1,000 shillings for kids, and then 250 shillings for adults, okay? So for you to buy the advanced tickets, that is what you are supposed to do. As you can see on your screens, labda tubakito hapo kidogo, because now we have something good. Maybe you can go back a little bit. Yes, perfect. So we have something for everyone, for the first come, first serve. All right. So for you to get your advanced tickets, all you have to do is dial *672*55#, or waende pale kwenye website www.madfund.com. So *672*55#. Okay? So already nimewambia what you're supposed to do. Advance tickets, we're buying them from MadFund. So www.madfund.com. So ukitumia ile *672*55# or the website, yote itakupeleka the same place. So this is what is happening. So for the people who are buying the advance tickets, buy now and then send me the screenshot. So for the first 5 people who buy these advance tickets, we'll be having something beautiful for you. We'll be having a gift hamper that is being given, it's a gift from KCB Bank. All right? Perfect. So as you can see, the KCB Cab account will be having a gift hamper for you. So for the people ambao muna plan kukuja, it will be a good time. So you shouldn't plan to miss. So when if you're planning to come, please make sure that you buy the ticket. So buy the advance ticket and then take a screenshot, and then on my number 0721 105 105 on WhatsApp, send the screenshots. Okay? So I'll only be giving these gift hampers to the first 5 people. So the first 5 people who buy the ticket will be getting an amazing gift hamper from KCB on that amazing day. In fact, hatukupei hivi hivi. All right? So Moji Shot Baba will be the one who will be giving these gifts, and utaitwa pale kwa stage. You'll be given the gift. We will appreciate you. So make sure you buy the ticket now. And you've said it's only the first 5 people. So kidunua late, huwezi ni blame. Sawa sawa. So dial *672*55#. All right? And then the advance tickets go for 899 shillings for kids and 200 for adults. And also to add on that is that these 899 shillings for kids are inclusive of games and lunch. Okay? And then for adults, it's inclusive of a refreshment. So it's a really good deal. On the 30th of November, pale Cyprus Park, kuja tujibambe pamoja, we dance, we sing, we eat, we'll be having an amazing time. On that particular day, we'll have a game where you spin and win with the KCB Cab account. But also for the first 5 people who'll be buying that ticket, they'll be receiving a gift hamper from KCB. Okay? So buy and then send the screenshots to me on 0721 105 105 on the WhatsApp number, and then we'll be giving a gift hamper to you. All right? So do not miss out. It's going to be really amazing. So that is it. I'm sure as we go on with the day, you'll be seeing the adverts, you'll receive the poster. So for anyone who wants to come with their kids, with the siblings, with the friends, you'll have enough information right there. So that is it. Now let's get the Did You Know today. And today's Did You Know is very, very, very interesting because it's talking about something that you'd want to confirm a bit later. So let's get the Did You Know. And it has been prepared by the one and only Martin. Yep. So wacha tuone Matu ametutayarishia nini ndani ya Did You Know today. And of course tumesema pale ndani ya Did You Know, it's something that you would want to confirm later. All right? And as we continue to, waiting for the Did You Know, it's very good and important for you to just remember that as MBCI TV, Nakuru people, you've been asking, we have had, now we are on Pang. Sawa sawa. So I've felt it's good to throw it in there, so you can share with your friends. Watu ambao wanauliza, oh, atuwaoni, blah, blah, blah. In Nakuru, you can always get it pale Pang. Sawa sawa. So let's get the Did You Know? All right. Sawa sawa. So we'll be getting the Did You Know a bit later. For now, let's get the today's inspiration. Tuone mambo yako namna gani, because we need to get inspired as we continue with the day. All right. So as you can see today on the today's inspiration is that small minds will always disparage your ambitions, but great minds, will give you encouragement that you can become great too. So surround yourself with people who have great minds. Okay, because great minds will encourage you to become great as well. So you are the people who surround you. You are what you read, you are what you take in, you're the people who surround you. Sawa sawa. So it's very important for you to know that small minds zitafanya hata bebe, you can't think big. All right? So make sure that you surround your people. There's is it a quote? I think it's a quote. It's a quote or it's a book somewhere that says, if you're walking around with 6 millionaires, then you're the 7th. But if you are walking around with 6 thieves, then automatically that means you're the 7th. All right? So around you, nikinani wako, what do they do? All right? How do they think? How do they reason out things? Are they people who can help you in business? Are they people who can help you in your ministry? Are they people who can help you to grow? Ama ni watu tu wa kupiga story, wa kupiga moshene, udaku kidogo here and there. Those people, you will stagnate if those are the people who you're surrounding yourself with. So make sure each and every day you look around. Ni kina nani wamekuzunguka, because great minds will help you be great as well. Sawa sawa? So that has been it today. Thank you so much for tuning in. It has been an amazing time talking about pneumonia, and we've really learned a lot. So it's very important for you to know, kama una feel kuna any issue, make sure you go get checked. Usikae nyumbani sana. We've heard that pneumonia is killing thousands and thousands of people. Sawa sawa? So please make sure that you go get checked. Now, let's get the did you know as we wind up today's show. Afya Clinic, which has been amazing, on the 13th, of November 2024. So the did you know today says that the average person has about 100,000 hairs on their head. Did you know that? Did you know? Would you be able to count? No, ni nyingi sana. But the thing is, an average person has about 100,000. Do you know 1,000 vile ni nyingi? So imagine 100,000 hairs on their head. So maybe that's something you'd want to continue, continue researching more. Go check out utaone hiyo maneno. Sawa sawa. So asante sana for tuning in today. We do value your time. God bless you. God be with you. Enjoy the rest of your viewing. My name is Kahugo. You can find me on all social media pages as Kahugo. Sawa sawa. So ukienda pale, you will see today's poster on MBCI TV official YouTube page. You'll find today's show. So if there's something you need to confirm, is already pale, and of course on Facebook as well. So next week we'll be talking about why is it that nowadays we're becoming very resistant to drugs. What is the issue? Is it our bodies? Is it the diseases? Is it the drugs? So we'll be getting to know more about that and what exactly are we supposed to do. All right? So we'll be talking about that. But until then, God bless you. God be with you. Enjoy the rest of your viewing. Enjoy the rest of your week. And just to throw it in there is that Friday we'll be having an amazing guest who has an amazing testimony, who is a minister of God, who is a musician, and he won't be here alone. He's called Minister Harriet Blessing. This is a man of God who received his miracle during the Rema Fest. He was paralyzed. And I know we're going to be hearing the story on Friday, but it is a testimony that you do not want to miss. So that is it. God bless you. God be with you. Enjoy the rest of your viewing. Until then, bye-bye.